Recent reports indicate a strong anti-mosquito campaign in Guangdong, with dense white smoke filling the streets and communities, causing a foggy atmosphere throughout the city. This action follows an outbreak of Chikungunya fever, or CHIK, also known as the Chikungunya Disease, which has now spread beyond Guangdong to other provinces in China, including Beijing, Chongqing, Hunan, Hong Kong, and Macau. On July 29th, a national teleconference was held in Beijing by Chinese authorities to address the chikungunya fever epidemic. On the same day, Foshan initiated a Level 3 public health emergency response. From July 29th to 31st, free nucleic acid screening for the virus was conducted in Lecong Township. On July 22nd, the Beijing Center for Disease Control and Prevention announced occasional imported cases of the virus in the city. On August 2nd, the Hong Kong Department of Health confirmed the first imported case of chikungunya fever in Hong Kong since 2019. The patient, a child who had stayed in Shunde, Guangdong for 2 weeks, returned to Hong Kong with symptoms of fever and joint pain. The 12-year-old boy residing in Guangdong began showing symptoms such as fever, rash, and joint pain on July 31st. Despite the mild symptoms, the child was referred to the United Christian Hospital emergency room on August 1st, where his blood samples tested positive for the CHIK virus. The patient's household contacts, including a companion, are currently under medical surveillance. On August 1st, Hong Kong doctor Wang Cun reminded citizens on Facebook that diseases such as dengue fever, malaria, Japanese encephalitis, yellow fever, and Zika virus, all transmitted by mosquito bites, remain a threat. He emphasized the chikungunya fever currently lacks a specific treatment and can only be managed with fever reducers, fluid supplementation, and other supportive measures. Professor Yuan Guoyong, chairman of infectious diseases at the University of Hong Kong, also warned the public to avoid unnecessary travel to Foshan in the near future. On July 18th, the Macau Health Bureau reported an imported case of CHIK fever. The patient, a Macau resident, had traveled to Shunde, Guangdong, from July 8th to 17th to visit family. CHIK fever cases are not confined to China, as the Indian financial hub of Mumbai is also currently grappling with a rare triple epidemic, which includes chikungunya fever. Alongside this, the city is also seeing a surge in cases of dengue fever and malaria. The city's densely populated environment, combined with poor drainage and seasonal rainwater accumulation, continue to provide breeding grounds for mosquitoes. According to local media, between January and July 2025, chikungunya cases surged fivefold, from 46 to 265. Dr. Divya Gopal from a local hospital emphasized the importance of eliminating mosquito breeding grounds, pointing out that while repellents and mosquito nets help, they cannot replace the need to clear stagnant water. To the east, neighboring Bangladesh is also facing outbreaks of dengue fever and CHIK fever. The chikungunya outbreak has drawn international attention. On August 1st, the U.S. Centers for Disease Control and Prevention, CDC, raised its travel advisory for China to Level 2, urging Americans to avoid non-essential travel to areas affected by the outbreak. The CDC also recommended travelers to take preventive measures against chikungunya fever and consider vaccination before traveling. According to Deutsche Welle, World Health Organization (WHO) experts have warned that the chikungunya epidemic, which began in the Indian Ocean Islands, has since spread globally, affecting nearly 500,000 people. WHO medical officer Diana Rojas Alvarez noted that, like 20 years ago, the virus is now spreading to regions such as Madagascar, Somalia, and Kenya, as well as Southeast Asian countries like India, Sri Lanka, and Bangladesh. She urged nations to stay vigilant to avoid a repeat of the global spread of chikungunya fever from 2 decades ago. Public data indicates that chikungunya fever is an acute mosquito-borne infectious disease caused by the chikungunya virus. Doctors report that the infection causes sudden high fever, reaching over 39 degrees Celsius, lasting for several days. Additionally, severe joint pain, particularly in wrists, fingers, and ankles, can leave patients unable to hold objects. A rash typically appears 2 to 5 days after the onset of symptoms, potentially affecting the face, limbs, and even the palms and soles, with notable itching. In China, CHIK fever has also been reported in other regions, including Chongqing and Hunan. Hey friends in Guangzhou, make sure to light mosquito coils, use mosquito repellent, and set up your mosquito nets while you sleep at night. These mosquitoes are really strong now. They've made it all the way to Guangzhou. As of August 3rd, 2025, Guangzhou reported one confirmed case of chikungunya fever. Local vloggers have also reported that disinfection efforts are underway, advising residents to clear any small drains and stagnant water indoors, and to wear long sleeves and pants outdoors to avoid mosquito bites. In July 2025, experts from various districts in Chongqing gathered to conduct a risk assessment on chikungunya fever and dengue fever in the region. Although no new cases were mentioned, Chongqing also released its first mosquito surveillance data this year, with Foshan being identified as a high-risk area, while 26 other districts are considered medium risk. Hunan has also reported cases. On August 1st, the Xiangxiang Morning News reported that the number of CHIK fever cases has been rising recently. The Hunan Center for Disease Control issued an urgent reminder, noting that there have been imported cases in the province, with a risk of further infection. According to reports, Huang Yi, chief technician at the Hunan Provincial Center for Disease Control and Prevention, explained that the Aedes mosquitoes, which spread the virus, are very common in Hunan. These mosquitoes are black with numerous spots on their bodies and legs. One infected person could potentially infect a group of mosquitoes, and a single mosquito can bite multiple people. Huang Yi also pointed out that many workers from Guangdong are currently in Hunan, and with the summer tourism season, there is an increase in movement of people, raising the risk of imported cases and the potential for local outbreaks. The Hunan Center for Disease Control also issued in August Disease Risk Forecast and Prevention Index Assessment, highlighting CHIK fever. The prevention index for CHIK fever has been rated at level 2, high. The CHIK outbreak in China has also raised concerns in Taiwan. On August 4th, Taiwan's Center for Disease Control raised its advisory for travel to Guangdong from level 1, watch, to level 2, alert, urging citizens to take additional protective measures when traveling to the affected area. Dr. Chen Yuanyu, a former attending physician in the Department of Infectious Diseases at Taipei Veterans General Hospital, told the media that CHIK fever can spread rapidly within a short time. In communities with high mosquito populations, one infected individual could transmit the virus to over 2,400 people within 30 days. He explained that many infected individuals have mild or undetectable symptoms, and the virus can become contagious 2 days before symptoms even appear. The Centers for Disease Control noted that, unlike dengue fever, some patients infected with CHIK fever experience prolonged fatigue, with joint pain that can impair movement, lasting from weeks to months or even years. High-risk groups include newborns, individuals over 65 years of age, and those with a history of hypertension, diabetes, or cardiovascular disease. The Centers for Disease Control also reminded travelers planning to visit CHIK-affected areas to take preventive measures, such as wearing light-colored long sleeves and pants, using mosquito repellents approved by government agencies that contain DEET or picaridin, and informing airport quarantine officers if they suspect they may have been infected. In early July 2025, Shunde in Foshan, Guangdong, was the epicenter of a local chikungunya fever outbreak transmitted by Aedes mosquitoes. State media Shangguan News reported on July 31st that, as of July 29th, Foshan had recorded over 6,000 cases. On August 3rd, the Guangdong Provincial Center for Disease Control released a monitoring report for the week of July 27th to August 2nd, revealing 2,892 new local cases of CHIK fever. No severe or fatal cases were reported, although Huizhou saw its first case.
今天一起床那个手好很多。
When I woke up this morning, my hands were all red, just a big patch of redness. My feet were the same, all red too. It's so scary.
这个发烧呢，怎么说呢？
The fever, my head hurts so badly. It's not like a normal fever. A regular fever, you just sleep it off for a few days and you're fine. But with this one, it's already been 9 days. There's no special medicine for it. They just give me stuff to boost my immunity or some medicine to reduce the fever, but they don't really work. The fever comes back after a few hours. It just makes my head feel so awful. The chikungunya outbreak in mainland China is raising increased concern. On July 30th, vlogger Liaoge Food Safety expressed worries about the potential mutation of the chikungunya virus in China. He explained that the greatest concern was the possibility of mutation, as the virus is a single-stranded RNA virus. He compared it to COVID-19, which also belongs to the same category of viruses. The reason the COVID-19 virus was so potent was due to its high mutation capacity, which many people have experienced firsthand. Aside from the potential mutation, the methods used by authorities to control the outbreak have sparked memories of the strict lockdowns during the COVID-19 pandemic. Many people have complained that the authorities' actions are causing widespread panic.
核酸又来了，抽血也来了。
Here we go again with the nucleic acid tests, blood draws, and the long lines for testing. It's like we're back in those COVID-19 days. Even the aunties dancing in the squares at night have to light mosquito coils and carry mosquito swatters. Every community and village is going through a massive cleanup, flipping over pots, cleaning out green spaces, and even the barren land isn't spared. Some villages are even forcing residents to remove farming tools and crops from their homes. On July 28th, a resident of Foshan posted that the southwest sub-district of Hunan in the city's Sunshui district conducted CHIK fever checks and mosquito control efforts, breaking into homes by force. The property management company unlocked and broke into the home because no one was present. On July 25th, authorities in Foshan's Guangdong district punished residents of rental properties who refused to cooperate with house-to-house inspections by cutting off their electricity. According to reports by Ming Pao, in the Dongping Community Health Service Station in Shunde, Guangdong, doctors said that patients showing symptoms such as fever and rashes must undergo blood tests. Neighborhood committees were also notified to take locals to designated hospitals for isolation and observation. Patients with negative results could be released from isolation, while those who tested positive will remain in the hospital for continued treatment. Health authorities also visited the homes of close contacts for blood testing. A pharmacy owner in Chongqing village stated that the forced isolation was affecting people's livelihoods, especially since the economy is already struggling. In Guangzhou's Haizhu district, just next to Foshan, a recent confirmed case of chikungunya fever led to a full sanitation operation by local authorities, including mosquito control measures in some apartment blocks. These measures were met with complaints from residents about disturbances. Low-level prevention workers also expressed their frustration on social media, describing their exhaustion from long shifts working under the hot sun and rain. Outside Guangdong on July 29th, the Fuzhou Disease Control Center issued a statement requiring people traveling from high-risk regions, such as Guangdong's Foshan, to conduct 14-day self-health monitoring. If any symptoms such as fever, joint pain, or rashes appear, individuals are advised to seek medical treatment and inform healthcare providers about their travel history. Reports on the internet indicate that some areas in Zhuhai, Guangdong, are now screening individuals with a travel history to Foshan. Certain hotels in other cities have started refusing to accommodate visitors from Foshan. Regarding forced isolations, Dr. Chen Yuanyu, a former attending physician in infectious diseases at Taipei Veterans General Hospital, told the media that this approach might be an effort by the Chinese authorities to demonstrate their ability to take decisive action. He suggested that this gives the illusion that an authoritarian system is superior to democracy and is being used as a propaganda tool. He also argued that the severity of chikungunya fever is low, with a low death rate, and that the primary method for controlling the epidemic is mosquito control. He stated that isolating people is not effective. Dr. Lin Xiaoxu, an American virologist, remarked that isolation is not necessary for the chikungunya outbreak because the disease is not transmitted from person to person. It is spread by mosquitoes. He emphasized that as long as mosquito control efforts are effective and environmental sanitation is maintained, the epidemic can be controlled. Dr. Lin also criticized the government for requiring nucleic acid tests, claiming it was a scheme to profit from the public by colluding with pharmaceutical companies. He alleged that these tests are used to deceive the public and that blood samples may be used for organ donation purposes. While nucleic acid tests may be free, other costs at hospitals are not, allowing the government to profit in various ways. In addition to disrupting people's lives with forced isolation, authorities have also begun strictly controlling the sale of medicines for chikungunya fever symptoms. On August 1st, the Foshan Market Supervision Administration announced new controls on medicines used to treat fevers, rashes, and joint pain caused by chikungunya. Purchases at pharmacies in Foshan will now require real name registration, with customers asked to scan QR codes for identity verification and provide personal information. A list of 47 medicines, including children's formulations, are now subject to real name registration. Of these, Lianhua Qingwen capsules, in particular, have attracted online criticism. Some users mocked the product, calling it a cure-all miracle drug or a universal sickle, and others sarcastically wondered if Qin Shi Huang, the first emperor of China, could have lived to the present day if he had just taken Lianhua Qingwen. At present, there is no specific cure for chikungunya fever. Some internet users have commented, as long as there's no specific treatment, they just keep promoting these drugs, and speculated that the increased control over drugs suggests the outbreak is serious. Lianhua Qingwen is produced by Yiling Pharmaceutical and was first released during the SARS outbreak in 2002. The Chinese government promoted the drug extensively during the 2020 to 2022 COVID-19 pandemic. It was mentioned several times in official treatment guidelines issued by the National Health Commission and the National Administration of Traditional Chinese Medicine. An article by the Dingxiang Doctor platform warned against using Lianhua Qingwen for COVID-19 prevention. The article noted that the drug has not undergone rigorous clinical trials, making it impossible to verify its effectiveness in preventing or treating diseases, and could even have side effects. Moreover, countries like the United States, New Zealand, Sweden, and Australia have banned the importation of Lianhua Qingwen. It seems that whether for COVID-19 or chikungunya fever, if the authorities want people to buy something, regardless of whether Lianhua Qingwen can actually cure anything, they are forced to purchase it. Ultimately, this serves to profit from the public. Sadly, not only do Chinese people have to suffer from illness, but they are also forced to accept the authorities' so-called medicines.